Welcome back to Shared Practices. This is episode 11 of season 2 with your host, Dr. Richard Lowe and George Hariri. This is a follow-up episode. Tell us about this episode, George.
Well, Richard, when you brought me on as a co-host, I immediately thought of who I wanted my first interview to be with, and Dr. Derek Williams is a good friend of mine. He was in season 1, episode 2, and in that episode, you kind of talked to him about his acquisition and the process of finding his office that he bought in Texas. And you actually interviewed him, I think, in his second week of ownership. When I listened to the episode again, I think that's what it was. And so I follow up with Derek in his 10th month of being a practice owner, and we talk about his transition. He's actually more than doubled the revenue of the practice. He's just had an explosive growth over this past year, and we really dive into what led to that growth, and we try to kind of dissect that process and hope to shed some light for our listeners.
Yeah, he's been crushing it, and it's been really exciting to see, like, for him to go from 0 to 60, overcome everything, and then just to hear the difference even in his voice. Like, you even mentioned it during the interview, the difference in his voice and his confidence is actually really cool.
It's really a great episode because what he really goes through is becoming a dentist and a practice owner at the same time. And you can kind of see that when we're talking. You can really pick up on his growth as not only a clinician, but also as a business person and a practice owner. It's a really great interview.
Awesome. Well, let's get right into it.
I'm very excited today to have with me a good friend of mine, Dr. Derek Williams. You'll remember him if you listen to season 1, episode 2. Derek graduated from Creighton in 2016, and he bought a practice in Lufkin, Texas about a few months later. I'll let him kind of introduce himself, and we'll go ahead and get started. We're kind of updating him since he's been there for almost a year now.
Yeah, well, it's good to be back, George. Fun to be interviewing with you this time.
Yeah, I know. I'm gonna maybe interrupt you a little bit less.
It seems like I'm sure Richard might edit that part out.
We'll keep it in. So, Derek, why don't you go ahead and introduce yourself to our audience? Maybe they didn't listen to the episode.
Yeah, sure. If anyone hasn't listened to the episode, I'm basically just kind of a quick summary about me. I decided in high school that I wanted to be a dentist, applied, and I just graduated. I went to Creighton University in Omaha, Nebraska. It's a private school. There's no specialty programs there, so I got a lot of really great clinical experience. I spent quite a bit of time trying to understand practice management and the business side of dentistry. Probably most of it came from just reading different business books and Dental Town. I created a group on Dental Town called Ambitious Dental Students and networked and found a bunch of other students like me and some really cool mentor figures. And that's actually how you and I hooked up, George, and you're probably the most active person in that group. And so it's kind of been kind of fun. It's kind of come full circle. And I feel like, people listening, they don't know you and they don't know the incredible amount of time that you've put into everything. So I just wish there was a way for people to know how much you know about things without having gone through it. You actually helped me do a lot as far as looking at different practices. In the Ambitious Dental Students group, we had Hunter Smith come in and kind of talk about how he analyzes opportunities and stuff. And I know you and I kind of went through that a lot, and you created a bunch of spreadsheets, and that allowed me to analyze practices more quickly and to kind of find good opportunities. Anyway, so
that's a great summary. I think somebody who listens to the episode definitely got a good idea. And I do want to say one thing, though. I really appreciate you letting me in on your process. Maybe a couple years ago now it all started, where you were entering your 4th year and you were kind of getting ready to look. And I think for me, kind of having that, sidekick role and watching you and, having an up-close view of what you were doing, it allowed me to have some experience so that when I went through it, it felt natural for me and I was definitely more prepared. And so I do appreciate you kind of opening up to me throughout the whole thing and letting me help you out. And I learned so much in that process.
Yeah, it was definitely a win-win for both of us.
So you bought this practice in Texas. You went in, and when we recorded the first episode, you were in your second week of ownership. So kind of think back to your second week of ownership. How does that feel now? How long have you been owning that practice now?
It's been about 9 or 10 months. So it's funny. I guess I didn't realize it was only in the second week. It seems like it felt like it felt like it had been a couple months at that point. I didn't realize it only meant two weeks.
I think when it was released, it was a couple months, but the actual recording, I think you had just finished your second week, and you were talking about your first week and how overwhelmed you were.
Yeah.
And so,
yeah, it was definitely overwhelming in the beginning.
So how long did that transition kind of last, where it felt really overwhelming and you felt like you were really adjusting to ownership?
I mean, it continually got easier. Kind of week by week, it got a little bit easier. But, I mean, I think the first month I lost like 20 pounds.
Oh my
just
gosh.
Because I'd get up in the morning, I wasn't sleeping super well, and I'd get up in the morning and I would just have knots in my stomach and didn't feel like eating. So,
what was keeping you up at night?
Oh, it's just like little stresses of things. I mean, it's everything. I mean, it's all these different thoughts that are going through your mind. Every day you're meeting patients that you meet in the beginning. They're all brand new, and you're thinking, are they gonna like me? Are they gonna, accept me for who I am? Do I need to try and act a certain way? How do I present treatment to these patients when I have basically no goodwill with them? And then there's the whole clinical side of things as well. Now that I look back, it feels, it's been almost a year. I think how crazy it was that I came right out of dental school and just jumped into a full schedule in private practice. So those, just thinking about the schedule the next day, and, it's very overwhelming in the beginning.
Do you feel like an associateship would have helped you out in the transition, just to seeing that many patients and to having that kind of clinical workload?
Yeah, I do. And I think, and it's generally what I recommend to everyone. I think it's the safer route. I mean, it is quite a bit of risk to go right into practice ownership, literally having no experience in private practice.
So in your situation, your seller left. Because your seller just was not willing to stay on. Do you feel like had he stayed on, that would have helped you, or do you think that would have held you back?
Yeah, good question. It's funny because during the whole negotiation process, I really wanted him to stay on for, 3 to 6 months and kind of be a little bit of a mentor figure and stuff. And I thought that would work out. And then he ended up just not wanting to at all. And the more I've learned about him, he was just done. He really didn't want to be in the practice anymore. So anyway, initially I was thinking that would have been a really good thing. But as I've been in the practice now, I've realized that it would have made things probably very difficult.
Well, yeah, because you guys, from what I've kind of been hearing about it, were so different, especially diagnostically. I think that could have been potentially a issue where, you guys are diagnosing so differently.
Yeah, I mean, you kind of think about it, and you can kind of see things from, think of it as if you're a guy, and he's 70 years old, so he's been practicing, he's been in the same location, same general patient population for 40 years. And he's just done, and so he took off a lot of time. You just think of that kind of mindset where, a lot of us, probably most of us, or most of those listening, are younger and kind of more ambitious and want to grow and want to do things. But I think it's very understandable to realize that a lot of the older dentists may, be very content and don't want to embrace awkward situations or be real confrontational with patients. Anyway, so yeah, I mean, a simple example is, if a patient came in and, had a broken tooth and a tooth that really needed a crown, if he felt like they couldn't afford it, or if he just didn't want to, he would just say, well, yeah, let's just patch it up and we'll get some more use out of it. So a lot of times I'm finding out that he didn't even offer different options for treatment. He kind of just went very conservatively. And I can see that if he was still in the office and, I come in and I tell the patient, oh, no, you need this, and this is the best thing to do. It would have been very easy for them to say, well, can I just have Dr. So-and-so look at this
what you mean.
and just get his opinion on it? And that could have been very difficult to work through. And there was, that's just one example of a type of treatment, but it really goes along with a lot of different treatments, perio, fillings, extractions, abscesses, a lot of different things like that. So it's not just the crown, but that definitely, that type of mentality.
I see what you mean. And I was wondering, kind of along those lines, when you walk into a POE, an exam, a patient that's been there for a long time, and they have a lot of needs, how do you handle that?
I try and gauge the situation. And it's been different along the way. But I mean, right now, how it goes, I mean, most of the patients I've already seen and have already gone through this process. But so let's say a patient comes in, just for their checkup, and they've got, I mean, it wasn't uncommon for me to find like an abscess in a tooth because we took a full mouth series. The patients had never had full mouth series,
Wow.
pretty much just 2 bite wings once a year. And then, a PA of something else if they were having problems with anything. So we've found a lot of disease that has been there. But then even things like abfractions or, non-carious cervical lesions, different types of things that maybe are not any kind of an urgent need, but I think at least need to be discussed. Those things I'm taking pictures and I'm discussing with patients. I tell them, and I'm talking and saying, I don't know if this has ever been addressed before. This is not anything urgent. It's a slow process, and these are the risks of not doing anything. And here's the benefits if you want to do this type of treatment. So I try and be very open-ended. I basically tell all the patients, I say, my job, the way that I view my job as a dentist is just to let you know exactly what's going on in your mouth and let you make the decision on how you want to approach it. I can't make a decision for you. It's your mouth, it's your teeth, it's your life. I'm just here to deliver the message and help you make informed decisions. And I think I do that just because I don't like the feeling when I'm getting a hard sale on something. And
Yeah, me neither.
Obviously, I'd like to do the dentistry for the people, but it's not worth it to me to pressure to tell them they really need to get it done. So I just offer the options and I let them make a decision.
So how long would you say, because obviously, POE most times is every 6 months. So would you say like the first 6 months you kind of had that a lot, and then after that it kind of eased out where you had seen patients a second time and then it kind of got easier?
Yes, for the most part. And there's been patients coming back now for their second recall since I've been there. And, maybe we talked about some treatment last time and they decided not to do anything and just talk about it again. And maybe this time they'll say, yeah, we talked about that last time. And I think I'm ready to just go ahead and do it. Or there are cases where I'm seeing several different things, and the way that the patient is acting is seems like they're not really happy to be there, not happy that I'm the new guy, and so in that situation, honestly, I might approach it differently and only discuss more urgent needs with them if there are any, just because I'm trying to kind of build up a little bit of trust before I present, more ideal treatment.
Absolutely. And one thing that you discussed in your first episode with Richard, you talked about kind of this feeling when you first graduated of feeling like responsibility to the patient to make sure they have a good experience versus when you were at a dental school, you kind of told them, well, you're at a dental school, so this is kind of what you can expect.
Yeah.
So kind of, when did that, are you more comfortable with that now, and kind of when did that process really set in for you?
That's a good question. I'm definitely more comfortable than I am now. I'm to the point where I start to get frustrated with patients rather than just trying to just please them with every effort that I have. I think you have to find a balance. If you try and make every single person happy and have a good experience, you're just going to feel like you failed every day because, people, let's face it, people don't want to go to the dentist. They don't want to pay to go through this experience. So I just try and do the best that I can to help them have a good experience. And for example, a couple days ago, I had it was probably 16 or 17-year-old boy, and his mom came with him. He had a tooth with gross decay. It was number 31. We could have done endo and crown, and they opted to extract. And I started discussing it with him, and the boy just kind of starts freaking out. What? We're going to do this and this. And I just kind of point blank, I said, look, if you want to get this done and you want to do it here in my office, then you need to settle down, and we need to work with each other through this situation. When you're
way to go.
Yeah. I just said, you can't act like that. It's stressful on me. It's stressful on my staff, and it's stressful on other patients to hear those kind of noises. I know that you don't want to be here, and I know you don't want to get the tooth pulled, but we got to work together if we're going to do this. If we can't, then, either you might have to see an oral surgeon for IV sedation or find some other way to get this work done. And I just got up and I said, I'm gonna give you a few minutes to kind of compose yourself and figure out what you need to do. So I walked out and came back in, and from that point on, he didn't move a muscle, and we got the tooth out, and I had him bite down on some gauze and sat him up, and he said, "What? Did you do anything?" So he didn't. Anyway, so you're finding a balance the more you practice, and I think you can practice years and years and still not have it totally down and still feel like, a failure at different things, but it's trying to get better.
You sound so different to me now, because I listened to your other recording this morning to get ready for the interview, and it's like night and day. Hearing you talk now about your experience with patients and kind of the confidence that you have, I really urge everybody to go back and listen. Season 1, episode 2. I mean, it's really fun to hear. I do want to kind of pop into the practice management side of things more now than just regular being a dentist. Your practice kind of proves me wrong in what I said in my episode with Richard. I told him that internal growth for the office, you really can expect about 30%. I think any more than 30% is kind of an unusual circumstance, and I think your practice is an unusual circumstance. I want you to kind of talk about when you came in, what happened to revenue, kind of bumps, and we'll talk about percentages, not actual numbers, and then maybe why you think that happened, and then maybe I went back and looked at your office, so I'll kind of note some observations I made looking back at it.
Yeah, I mean, good question and good points. And one of the things that after talking to Hunter and kind of getting through this whole process and finding out what to look for in a practice and what makes it valuable to you, one of those things was just looking for opportunity. I think the perfect balance in my mind is buying a practice that's already cash flowing well, but still has a lot of opportunity for growth. And I think that's what I found in this practice. So he was already cash flowing well and had, 50% overhead, doing fine. But, my very first month, I don't remember exactly how much more, but it wasn't quite double, but it was almost double what they had been doing normally in previous months. And now after 8 or 9 months, we're probably consistently 2.5 times more.
Yeah, I was going to say, I think you guys are between doubling and tripling.
Yeah, yep, that sounds about right.
That's crazy.
So the things that I would attribute it to, we are starting to get more new patients, and I think we'll talk about that, but really, I mean, in the beginning, we weren't getting hardly any new patients at all, but we were still growing a ton as far as production. And it just came down to treating people the way that I would have wanted to be treated. I mean, patients were coming in a lot of times, and they'd come in and say, "Doc, I got this tooth bothering me." And I'd look in their chart, and they hadn't had an exam, like a periodic exam in years. And they'd only had x-rays of teeth that had been giving them troubles. And so I would ask him, I'd just say, "Okay, it looks like you might have some other things going on in your mouth. We haven't had x-rays of the other teeth for a long time, or maybe even never. Would you like to just focus on this one tooth today? Or would you like to kind of find out everything that's going on? I just don't want you to dump all this money into one tooth and then find out that you've got other problems going on." You can kind of see that same process there. I'm still giving the patient options. If they want to just focus on that one tooth, then I'm going to. But they have the option, and they kind of understand that it's almost like an informed consent at that point, because then if they just want to focus on that one tooth and they spend a lot of money on it, and then, they come back a couple months later with another tooth that's bad, well, I gave them the option to look at everything before we did anything with that other tooth. So just that alone has allowed us to do more comprehensive dentistry, looking at everything and coming up with treatment plans that are going to help the patients get back to, having disease-free mouths.
I love this clip with Dr. Paul Johnson because I can relate to trying to make a prosthodontist happy, and that driving you both to do better and also maybe to the brink of insanity. Or maybe you buy a Form 2 from Form Labs and please everyone. Here's Dr. Paul Johnson. Tell me how your 3D printing experience evolved in your perio residency.
Well, I'd continued with the light business. I don't remember what the inspiration was, but I noticed that we had an issue in our perio department with our prosthodontics department. We had a Dr. Hansen. This is a guy I never wanted to disappoint. And every year, Dr. Hansen would put together a PowerPoint of basically some of the worst implant cases. And they were just, they were just almost like to the point of almost being unrestorable. And every resident, they knew that was their case. And so I made it my goal. And I told Dr. Hansen to never appear on one of Dr. Hansen's PowerPoints. And I said the only way I could do that was to incorporate 3D printing and 3D printing my own guides.
If you're curious about all the things that a Form 2 can do for you in your dental office, go to formlabs.com/shared practices. There's actually a button there that says request a free sample. If you click that button, it pulls up a menu of all the different materials you can print on the Form 2, including dental surgical guide resin. By ordering any of those samples, you're actually supporting the show by showing Formlabs that people are listening and willing to take action. So go to formlabs.com/shared practices and request a free sample.
So to summarize things for our listeners, if we're looking at you're essentially attributing your increased production per patient. You're talking about diagnosis right now. You're comprehensively diagnosing, so you diagnose more production per patient, and therefore there is a bump in revenue.
Right.
Did you do anything for any other, like case acceptance, for example? I think you've talked about before. What kind of things did you do to increase your case acceptance to also have a higher production per patient?
So the office, just about 3 weeks ago, we went digital. Before that, there was only 2 computers at the front desk, but nothing else. When I came in, I bought a tablet for like $100 and one of those Dario intraoral cameras on Amazon, both on Amazon, total for like, $250. And I just hooked them up, and I would take pictures of what was going on in people's mouths, and I would show it to them and say, here's what I found, here's your options. When people can see a picture of their teeth, it just makes such a big difference.
Absolutely.
Oh wow, that's my tooth? It really looks like that? And it's kind of like me going to a mechanic shop. I don't really know about what's going on in my car. So if they tell me something, I just gotta fork out the money or maybe get a second opinion. But, by me showing them a picture and explaining, it adds more credibility to what I'm saying and makes them take a little bit more ownership because they see what the condition is like in their mouth.
And you feel like that took the pressure off of you as a new doc who's coming in diagnosing more than the previous doc, that you were able to kind of show them something that's not you saying it, you're showing them, and you think that kind of put the ownership in their court?
Yeah, in a way. I think as far as who feels ownership for a problem has more to do with your approach and how you talk about things with patients, because patients want to blame things on the dentist. And so a lot of it, most of the time, I think it comes down to communication before treatment happens, and so it's, if I see a cracked tooth and, I tell the patient about it, and then they, I've had this happen multiple times where I tell patient that we should probably do something about this cracked tooth, and they come back in, oh yeah, sorry, my doc, my tooth broke, and say, oh yeah, well, we did talk about this at the last exam. And, anyway, it comes down to just having conversations and talking about, okay, this cavity is really deep. There's a high chance that we'll have to do a root canal on this tooth. Well, we won't know until we get in there for sure. And sometimes I just tell them to plan on it. And then if I don't think we'll have to, then then it's great news to the patient.
Absolutely. How did you handle the situation where a patient came in with an issue that has been going on that maybe was not talked about with them with the previous doctor, and then you're coming and telling about them? Did you have any patients who were like, why didn't I hear about this before? Why didn't somebody tell me, why didn't the previous doc mention it? Did you ever get that?
Oh, yeah.
How do you handle that?
Yeah, that is one of the more delicate issues that I've had to discuss. And it's not an easy one. And I don't know if there's a totally right way to do it, but kind of the approach I've taken is one of 2 ways. One is, in that situation where the patients just had limited exams and limited x-rays over the years, and then they find out they've got a whole bunch of work that needs to be done. And, they've got this attitude, well, I've been coming and seeing, the previous doc for so long, and I never was told this. And I just basically say, you know what, he was a great doctor and a really good guy. And a lot of times he was just trying to do what, fix the problem that the patients came in with when, there might have been other problems going on. And I just have maybe a little bit different of a mindset and try and let people know everything that's going on before we move forward. And most of the time patients are understanding. I mean, they liked the previous dentist, so they don't want to throw them under the bus either.
The reason why I'm so kind of wanting to know that answer is because when I was talking to my seller, one of the things that was asked of me is, what are you going to do? Because I was told that there may be a lot of treatment in the practice that potentially, they haven't talked about with patients. And I kind of told them I wouldn't want to throw you under the bus. That's kind of the last thing I'd want to do. So I think you handled it appropriately, not trying to make the doctor seem like he was being negligent, but at the same time, letting them know that there is a concern.
Yeah. I talked to a doc yesterday has merged. He bought another practice's charts and merged with his practice, and he's had to deal with a lot of periodontal disease coming in, and that's been a more difficult one for me to talk about. And he brought up a good thing. He said that in their discussion, he'll say, well, we're doing new things here. We're measuring your gums, and that hasn't been done before. So we're seeing things that Dr. So-and-so hadn't seen before. So, we're kind of discovering this, and we're thinking, this is the best way to approach it. So, he talked about it that way, which I thought was a good approach as well.
Yeah, kind of like a new technique to find new stuff, kind of.
Yeah.
That may have been missed before.
Right.
I like that.
Yeah.
So then you've had this initial bump in the practice. You come in, we've increased our production per patient without increasing the number of patients. So how did growth proceed kind of after that initial bump?
It's been kind of steady, getting a little bit more each month. And part of it has also been doing more procedures. So the previous doc didn't really like doing extractions. They weren't doing really any SRP.
Are you doing the SRP? Is your hygienist doing the SRP?
No, hygienist is. They weren't even diagnosing and really treating it before. And if they were, they just would send to the periodontist.
Wow.
What else? I've started doing a little bit of clear correct, kind of like Invisalign as well. I'm not doing anything crazy. I guess I've started doing some implants. I've done maybe about 10 implants. Just started doing that a couple months ago.
Have you noticed another bump in revenue when you started doing implants?
Not necessarily a bump. I mean, because I think a couple implants a month. Yeah, it definitely helps, though. I mean, there's been some times where it's felt a little bit slower, and being able to start a clear correct case or throw in an implant here, it's almost like helping to make up in other areas where it feels like when it lacks a little bit. So in general, our production collections has consistently gone up, and it seems like about the last 2 or 3 months we've kind of plateaued. And it's been interesting because I've started to feel like things are getting slower. But then when I get to the end of the month and I look at how much, the production that we're doing, we're basically doing the same amount that I've been doing the last few months.
It just feels easier?
Exactly. I'm getting a little bit more faster and more efficient clinically. So I've got more time, and so it feels slower to me.
And so when you're in this office, I remember when you first did your podcast, you talked about how they scheduled a patient every 30 minutes and you increased it to a patient every hour. I'm a scheduling nerd, so I'm going to ask you, how are you scheduling your patients, and what are you guys doing now, especially now that you're digital?
Sadly, I don't have a great answer for you. I wanted to get down to provider time scheduling, and we need to, but it just is something that we haven't implemented yet. The schedule goes fairly well. I mean, the front desk does it and kind of knows about how much time I need and where we can fit stuff in. So I pretty much stay fairly busy. We also added 2 full-time hygienists now. And so that requires, a few more minutes per hour for me to get in and do another exam, and especially if they're new patients.
So now your staff, can you just kind of go over, I remember before you were a front desk, maybe an assistant and a hygienist. So what are you now?
So we've basically just added 2 more. We have 2 full-time assistants and 2 full-time hygienists. We hired...
One front desk?
Yeah, still 1 front desk. We hired a part-time hygienist that came in 2 days a week, and she was on that schedule for probably 5 or 6 months. And then just about a month ago, we brought her on full-time. So now we have 2 full-time hygienists.
And I remember from, obviously we talk frequently, your office manager or one of your front desk individuals, some staff member left right when you came on.
Yes.
So can you kind of talk about that?
Yeah, she left. It was a couple weeks before I came on, and I was really nervous about it when that happened. I was just thinking,
what was her role?
Oh gosh,
What was her role?
Oh, she was working the front desk. So at that time, they had 1 front desk, they had 2 assistants, and 1 hygienist. Okay. So the front desk left. I was pretty anxious about it. They had one of the assistants go and work the front desk temporarily, and the new doc didn't want to hire someone else that, I would just have to pick up. So he said, well, we'll make it work with these 3, and then when you get in, you can hire someone that you want to work with. So that's what we did, and the previous assistant that moved to the front desk was just awesome, really great at staying organized and on top of everything, and I could even get her to go present treatment. So she was great, and then we looked through a few different dental assistants, and then hired one after, I don't remember how long it was, after a month or 2. I don't know if that answers your question.
So on the subject of staff, so kind of on Dental Town, everyone talks about their biggest stress of ownership is staff. Is that kind of what you found, and how have you handled the adjustment to having a staff?
I guess it depends on the week. There's some weeks where there's, everything with staff goes great. I don't really hear a whole lot. And then there's other weeks where there's drama and crap to deal with.
What kind of drama have you had?
Oh, just, I don't know, kind of like nothing real big. Just like, okay, we've added this new protocol, and now the hygienist is stressed about how to implement it and feels like she's too busy and can't do what she's being asked, or so-and-so talks too much and they're not helping and doing this when we need to be.
And so-and-so is another staff member?
Yeah.
Okay. So they're kind of,
so it's just
kind of everything.
Yeah, it's just a mixture of things. And 3 out of the 5 are, maybe I shouldn't say this, but I'm going to. They're menopausal age, and they talk about their hormone imbalances and stuff all the time, and they apologize. So I try not to get into it and what is actually going on, but maybe that adds something to it.
Oh my goodness. Okay, so on that subject, not on that subject, but kind of on the subject of staff. So you kind of have. You've prepared more than I think anyone I know that has gone into ownership thus far, I feel like. And of that preparation that you did, how much of it do you think helped with just kind of all the random stuff that gets thrown your way? Do you feel like because when in the first podcast you talked about how you felt prepared for things, do you still feel like all that time you spent was well spent?
I do. And I don't know, I just had that thought process while I was in dental school. There's just, a lot of people thought I was wasting my time and thought, you're not going to need this for so long. By the time you actually need this information, you're going to have forgotten it. But I felt like by reading books and getting things, preparing my mindset that, if it was kind of ingrained into who I was and how I approached things, that it would help me better when I was presented with those types of situations. So.
And I would definitely agree with that. I think I listened to your first episode this morning again, and a lot of things you just said, and they almost sound, and Richard even said, he's like, it sounds straight from the textbook, straight from Gary Tackus, straight from people who really know what they're talking about. And I think what happened is you spent so much time preparing that you just were good because it was just ingrained in you, like you said. Would you advise somebody else to do that, or how would you advise somebody else to prepare for ownership who maybe hasn't spent that much time on it?
Yeah, it's hard. Everyone is so different, and we all have different strengths and weaknesses. So I think you kind of have to evaluate yourself and think through different situations and think, where am I lacking the most? What's gonna help? There's such a broad, vast amount of things that you can learn. Even just clinically, there's so much that you can learn. And then you get into practice management. There's so many different areas. So I think,
Do you feel like your success so far has been more non-clinical or clinical?
I guess it depends how you define success. I mean, I feel like my clinical work is getting a lot better. It's getting more efficient. So I feel like I've grown a ton clinically, but I don't know that if you just look at the numbers, I don't know that my clinical ability really has a
lot to do with it.
Yeah, I think patients, I mean, we've all heard this before. Patients don't know what quality of work you do unless they're having pain or having issues with something that you've done. Really, all they know is how you interact with them, and can you get them numb without too much pain? Those types of things. So being able to talk to people and be kind goes a lot further than being able to do the perfect class 2 prep.
Absolutely. And I think I would agree with you 100%. On the subject of kind of the things that you've done non-clinically, you talked about your diagnosis, that's clinical, I guess, but case acceptance, I guess we talked about staff management. Is there anything else that you really feel like has made your transition, I mean, grown your practice 2.5 times, anything like that? What else do you think would have attributed to that?
One thing that I find in common with very successful people is that they are always willing to be trained. And so you look at the people that are the best at what they do, you know, even Tiger Woods has always had a coach. You know, you look at the people that are the best at what they do, and they're still always looking up to others and have mentor figures. So I decided early on that I wanted to have a coach or a consultant or someone that I could have, and I wasn't looking for something cheap or free or, you know, I wanted someone to feel invested in me and feel like they really were going to pay attention to my situation and give me good feedback. So when I first was in the practice, the broker had arranged for a consultant to help with the transition, which was great, and it served its purpose. But the way that she ran things, it was, you know, we'd have a meeting and she basically ran the meeting. I didn't need someone to come in and run a meeting for me. I needed someone to train me and to teach me how to lead my team. So we parted ways, and I found another coach, Justin Short. His group,
lifestyle practice.
Yeah, his group or his website is the Lifestyle Practice, and I've had really great experiences with him. He's helped me make a lot of decisions and to think through things. You know, when you were talking about reading books and kind of trying to gain all the knowledge on the front end so then you can deal with it later, that works to a certain extent. But a lot of times when you get down in the trenches, your vision is narrow and limited. And to be able to have someone else come in that has been in that situation before and can kind of see ahead and behind and around, it's very valuable for them to give their perspective and to, you know, kind of give you advice. And that's exactly what it's been like working with Justin. And it's totally been worth the investment. I think too many people think of the cost, and it prevents them from paying to find, you know, that type of figure for them.
Another great course that I found on speareducation.com is a course on how practices grow. Naturally, when we open our practice at first, we're focused on growth, and over time, if we don't think about it, sometimes that growth can stagnate. Here's Imtiaz Manji.
Now, everyone chooses their level of success because it's discretionary to them. And so oftentimes what will happen is we will choose a level of success and we'll drive towards it, and then we will go into this comfort zone. Then our comfort zone is where we are, and it's not a bad thing. And I'm not saying you have a bad practice. I'm just saying you're in your comfort zone, you're not growing anymore, and you almost do it subconsciously. You kind of just are programmed by the systems you put in place, and those systems then hold you back, and you drive those systems out of habit, and you remain at that level. And oftentimes the reason that occurs is there is no urgency. You're not thinking about it. It's not part of your DNA. You're not choosing success each day that I become successful. It's something that I've chosen to do. I want to be more successful at it.
This course goes through 5 levels of practice growth and how we can improve in each of those areas, from clinical to our office organization and systems, to the cases and the acceptance that we get on those cases. and then the vision of our practice, and eventually even the facilities. The course has handouts, calculators, exercises. It's a phenomenal 2.5-hour course that you could run through as an office over the period of a couple months and understand how and where you've stagnated and what you can do to improve. For access to this course and hundreds more like it, go to speareducation.com and request an extended guest pass when you mention the Shared Practices podcast. Use the promo code LOW200 to get $200 off your annual membership when you sign up.
That's great. And I really think that goes back to what you said of looking yourself in the mirror and kind of, addressing your weaknesses maybe through a consultant and addressing and accepting the fact that you may need one.
Right.
So now I want to kind of move on to new patient flow. We talked about how the office, I think when I looked at it, it was like, 14 patients a month, 14 new patients a month is kind of what you guys were getting before you came in?
Yeah, I don't even remember. It feels like it was less, but that might be right.
Maybe that was limited and comp exams. But anyway, so kind of talk about your new patient flow and how that's changed across time and maybe what you did or didn't do to affect it.
Yeah. So, I wanted to focus on Google reviews, building, a presence online and, just trying to get more referrals. We've basically been asking for reviews from patients, and I made this. A lot of my patient base is older, and so I took screenshots and showed how to write a Google review. And so we give that out to patients, and then we also ask for, who do you know that could benefit, that would need a new dentist or something like that. And so trying to get.
So you were mainly doing Google reviews?
Yeah. So kind of at the beginning, it was just more focusing on internal marketing and, doing what we could there to grow. And then we started looking at external things. I've done some ads in the newspaper here, and it's been very poor ROI. I've done some pay-per-click stuff with Google, which has actually been great. Not amazing, but still worth it. And then Justin helped me decide to do a mailer campaign. And so I've been doing that. I'm in the middle of that with dentalmarketing.net. So they designed my flyer, and we've got, I don't know, since we've been doing that, our new patient numbers are like 40 to 55. So that's helped us grow quite a bit.
And do you really feel the impact? I know it's a high number, but do you feel it like on your schedule and your day and
I think the staff feels it more than I do. It feels good to me. I love having new patients in the office because it just gives, and the staff like it too. They've told me, they're like, oh man, this is so cool. We've never seen growth like this in the practice. This is really exciting.
So they're kind of taking pride in the growth?
Yeah, they are. There's times when it can be a little bit overwhelming, but yeah, they've been happy about it. And as far as like just my schedule feeling it, I guess it hasn't felt a ton more busy. It's about where I like it. We could be a little bit busier, but
where do you like it?
I don't know how to explain it. I basically
how booked out are you? If I wanted an appointment to get a crown done, how long would it take me?
Oh, I'm sure we could get you in this week.
Wow.
My schedule usually has maybe 2 or 3 holes in it throughout the day, but a lot of times we'll be able to fill them. We do get a decent number of new patients just because we can get people in. And I've had I always ask new patients, how did you find our office? How did you decide to come in? And I've had several people say, you guys could get me in. I called so and so and then this office, and they couldn't get me in until next week, and I'm hurting, and so I came in.
And are you bringing them in on the doctor side?
It depends what their issues are. If they have a tooth that's bothering them or some kind of chief complaint like that, then we'll bring them in on my side. If they're just,
and that's the case where you could get them in like same day.
Yeah. And since we added a second full-time hygienist, she's not completely maxed out at this point. There's still a few holes here and there. So if we can a lot of times get new patients in quickly on that end as well.
So then you're 4 operatories right now, right?
Yeah.
So then you have 2 for the hygienists, and then you have 2 for yourself, correct?
Right.
So then how would you, if I'm calling in, is it an opening on your schedule? Or is it like you're in one op doing one thing and the other op is open and that's where you'll bring in the emergency?
I'm not sure if I understand your question.
Sorry, so I'm assuming you stagger your appointments, or how do you book your two ops? You said that they just kind of know how you like it. You kind of see one patient and then you kind of go to the other, or do you have two patients at once in those two ops?
It depends, but yeah, they are staggered. But like I might have two people at 1:00. The first one of them is going to be, fillings or crown or whatever. And then the other one is going to be a crown seat. So I'll go in and I'll numb the first patient, and then I'll go and I'll seat the crown in the other room. I'll go back and finish, I'll do the filling or crown prep, and then the assistant can start doing whatever she needs. And then I do the exams. And then hopefully by then we've got another patient ready to go back in that op where we did the crown seat.
So for the case, so let's just say I want to set up a scheduling, or you want to set up scheduling in a way that would allow a new patient, like an emergency patient, to come in that same day. Is it something that you guys do to allow that, or is it just you happen to have openings and so you guys put them in?
Usually we have openings, but even if we don't have openings, I'm telling the front desk, if I need to work through lunch or if I need to stay or whatever, if somebody's hurting, let's just get them in. And, even if it doesn't look like there's an opening, just tell them and just tell the patient, hey, you know what, we really don't have a lot of room in our schedule, but if you come in, we will find a way to work you in. And a lot of times, patients are very appreciative of that. And even if they have to wait, I'll come in and I'll meet him and I'll say, hey, sorry about the wait. And they say, oh, no, I'm just so glad you guys could see me today. I really appreciate it.
I see what you mean. So you're attributing it more to your mental flexibility as not only a staff, but as you to be able to accommodate an excess of patients at any given time.
Yeah, that sounds right.
So now you've kind of been in this office. Where the way we're talking, you would think that you've been in here for 5 years, but you're coming up on your 10th month. Moving forward, what are your plans? I know that you post on Dental Town, but kind of tell our audience, what are you thinking? What are your plans moving forward?
Yeah, so, I've kind of gone through a lot of changes in mindset and, working toward the future. I think in dental school, there's a lot of us that think, I'm going to open multiple practices and I'm just going to do specialty procedures, or I'm going to just manage them, or I'm going to sell, or, there's kind of this dream. And I've gotten to the point where, I just never imagined that we would grow this rapidly in this one practice and that it would go so well. So in the beginning, I was kind of more thinking about a second practice, but I've kind of started to view things differently. I feel like I have such an excellent quality of life. I come home every day for lunch, and I get to have lunch with my wife and kids. I only live 5 minutes from the office. I don't work Fridays. I decided this summer to close at 3 on Wednesdays so we can go and do something as a family on those days. The reason why I'm telling you that is because it's changed my mindset to know where previously I was thinking, okay, I could get a second practice going, and how much time will that require, and what will the return be on it? And with as good as the return is with my time in this practice, I'm hesitant.
Not sure if you want to invest more time. I'm totally
exactly. Yeah. So it's kind of basically right now, my mindset is trying to eliminate student loans and refinance other forms of debt. And then I'm starting to read some books about investing and just deciding where to put money and keep trying to grow the practice from where it goes from here. I'm not saying that I will never own a second practice, but at this point, it just seems a little bit less enticing to me than previously.
I really like that. And how is your schedule? You talked about your schedule and, how relaxed you are almost. How does it compare to being in dental school for someone like myself who feels like this will never end?
Well, it's funny because even in dental school, man, the first 2 years just sucked bad, and I just hated. I'd come home and I'd spend an hour with my wife and kids, and then I'd be studying again the rest of the night. And I didn't, I was a very average student. I didn't get A's. I wasn't real concerned about grades. I was just mostly concerned about learning what I felt was important to help me become the dentist that I wanted to be.
Is that kind of the advice that you would give somebody else looking to get into ownership?
Yeah, I probably would. I usually, when people ask questions like that, I usually say, have you decided whether or not you want to specialize? That's usually the first decision that you need to make. But, I think all of us dentists would agree that there is quite a bit in the curriculum in dental school that you really don't use hardly at all. And so focusing a whole lot of time on that type of stuff just doesn't make a lot of sense to me.
And what advice would you give to somebody who's maybe a year or two out and is now looking to buy a practice versus, what advice would you give them?
Someone that's graduated a year or two ago and looking to get into ownership?
Yeah, they've been an associate, they're, stable income, and now they want to jump into ownership.
Well, I mean, hopefully if they're at this point, they feel, fairly comfortable clinically. They know what type of a practice environment they want to be. I mean, I guess my best advice, if you're starting to look at practices, is to know what you're looking at and to put your team together. You need to have a CPA team that's on your side, and eventually an attorney that can help you work through all these things. I tend to get, because of starting the group on Dental Town, I tend to get attention from dental students or people that are young and starting to look into ownership and saying, hey, look at this practice. What do you think? And, I can give my opinion, but you really need to be working through these types of things with an expert and the type of person that is doing these deals all day long, all year long, rather than, just me that's done it once.
And what advice would you give to that individual who they found their practice, they bought it, and they're about to jump in, kind of from the time that your first podcast, released 2 weeks into ownership till now? What advice would you give them for that process?
Go into it with an open mind and try and be flexible. I think it's a tough position to be in, and it's tough for everyone. It's tough for the patients. It's tough for the staff. So if you come in and you're wanting to immediately make all of these changes with staff, that can be pretty tough on them. So the more, I guess maybe that was an advantage for me, is that I really didn't have a whole lot of experience with instruments or protocols or, certain ways to do things. So I basically just jumped in and said, I'll just do it however the guy before was doing it. So I was pretty flexible as far as that type of stuff goes. So being able to be flexible and have an open mindset, and then just trying to treat people well and just be yourself.
I think that was the big things I got from Hunter Smith when he first came on and did the Ask Hunter thread, which I think changed both of our trajectories quite a bit. We talked about, I'm asking him about his systems and all these specific questions about his office protocols, and he kind of stopped me, and he's like, look, when you're doing an acquisition, you're not so worried about these nitpicky assisted hygiene, efficient scheduling. You kind of just need to worry about getting adjusted, becoming a dentist. You have a cash flowing office, chill a little bit, and then you can start to change things more slowly. Is that kind of what you found going through the process?
Yeah, exactly. It's enough of a transition for everyone just getting acclimated to each other. So just try and let things flow for a while. And once it feels like, okay, yeah, we're kind of getting this down, then you can say, hey, let's tweak this just a little bit. I think this is really going to offer this advantage to us if we do it this way. What do you think? And be open. Don't say, hey, this is how we're going to do it, and this is the best way. Well, okay, does that mean we've been doing it wrong for this many years? Be open, or you can even say, hey, we're going to try this, and I want to get your feedback after we've been doing it for a week and talk about, the pros and cons of it, if we want to keep doing it, because ultimately it is a tough balance. I mean, you want to have the staff stick with you. Sometimes it's just not going to work out. But if you can have them stick with you and you can both learn to make compromises, I think that's the best way to do things.
I agree. It kind of reminds me, Derek, you read Good to Great by Jim Collins, right?
Yeah.
When they asked, so they did this book about these companies that went from good and they just had this rapid period of growth that kind of made them great companies. And they asked the employees or the executive members, what happened and, all these questions about what led to all this growth. And they kind of all said, you don't really notice it. It just kind of happens. And if it happens correctly, then the staff really shouldn't even feel like a lot is changing when actually a lot is changing. And so I think that kind of goes back to what you're saying with kind of taking it easy, taking their input, and then just kind of taking it as it goes and assessing what's the most important thing and tackling that.
Yeah, totally agree.
So before we wrap up, my situation well. I'm coming out. I'm pretty much doing what you're doing, except for my wife and I are doing it together. What advice would you give for me kind of now being 10 months almost out? What advice would you give for me going into the same type of thing?
I mean, I think right now you're basically at your best potential as far as learning clinically. After you graduate from dental school, you're gonna have CE that you can go to, but it costs money and you got to take time off and you got to travel. So the more that you can take advantage of every single little opportunity to try something new or to be more autonomous in a certain procedure and to always be asking for feedback and, looking at new systems or whatever it is. I just think that, if you feel like you're comfortable with, leadership skills and stuff like that, I mean, obviously those things are important, and be reading books and thinking of things like that. But I think when you're in your fourth year of dental school, I think that's a pretty good opportunity where you can just take advantage and learn as much as you can.
I appreciate that. I will take that with me this next year. And I really appreciate you coming on and sharing with us an update on how things are going. I'm happy things are going incredibly well. You definitely prepared for it, and it's no accident, that's for sure.
Well, thanks, George. I appreciate it. And I hope, I always want to be encouraging to others. There's no right or wrong way to do this. You kind of just have to, fill it out. Just because I'm doing this and having good success doesn't mean that everyone has to do this. There's a lot of people that don't want to do those things during dental school, and it doesn't mean that their approach is wrong. I guess my advice would be to everyone, try and learn as much as you can about what your opportunities are and what you want to get out of things. A lot of times, if you don't look into it, you're probably not going to get what you want out of it. But I'll quit talking. I keep rambling.
No, that's great. I was letting you go because that was just awesome. Thanks again, Derek. We really appreciate having you on. It's great to see that you're doing well, and I hope our listeners can take notes.
Well, I hope you guys enjoyed that. I loved that interview. Derek, it's interesting to see even his ambition mature. Like from before, he started this ambitious dental students group, and now he's like, you know what? I thought I wanted to do 2 practices immediately, and now I'm looking at, we're doing all right. Like, I'm pretty comfortable at this point. So it was cool to see him realize that maybe the things he wanted at the very beginning aren't the things that he really needs in the end. I don't know. That's one of the things that stood out to me the most.
I would agree with you. And to piggyback off that, he is working with Justin Short, who's kind of really big on that process of kind of not working as much and just being happy with a very solid income and not that much work. But I did want to add one point, Richard. In the episode, I mentioned that I would look back at his practice, the paperwork that he looked at beforehand, and try to figure out why or how we could have predicted that growth ahead of time. And when I look back at it, I looked at a crown to filling ratio, and I also looked at the number of x-rays taken in the office. And so when you look at a crown to filling ratio, you're really looking at crown to 3 or 4 surface filling ratios. And so according to Heartland, and I know that might not be the best person to quote, but just an idea, you want about 100 crowns to about 80 3 or 4 surface fillings. So when you look... So I'm sorry?
Where have you seen this number looked at before? Because this is the first time that anyone's ever brought up this crown to 3 to 4 surface filling ratio before, to me at least.
It's something I like to look at when I look at offices because it gives me an idea of their bread and butter, how conservative or aggressive are they diagnosing.
Okay.
It could also be misleading in an underserved population with a poor median income because they may not be able to afford the crown and bridge. But in Derek's case, I think this was more related to the diagnosis of the seller than it was an indication of the socioeconomic class of the population. But I did want to get back to that ratio. There's a thread on Dentaltown. Rick Workman references the ratio as 100 crowns to 80 3 or 4 surface fillings. So ironically, in Derek's location, it was about the same 100 crowns that were being discussed, but the previous dentist did 320, about 320 3 or 4 surface fillings. So about 4 times more 4 surface fillings, 3 or 4 surface fillings for the same number of crowns as what Heartland would consider to be average. So
Okay.
I think that's a really big indication that I could have looked at ahead of time that I missed when I looked at his office. The second one was Derek talking about.
Wait.
Go ahead.
Wait. So I want to take this and make this usable for our listeners. So could you, from the procedure codes by provider, Like where did you calculate this from? And therefore, where, if people are looking at a practice, where could they find this themselves and compute this themselves?
Absolutely. That's the whole, yeah, exactly. You look at the ADA procedure code by provider, and you look at the number of crowns that the previous provider did, the seller, and then you look at the number of 3 and 4 surface fillings. So what's that, D2393 and 2394?
Okay.
If you look at those codes, then you add them together, and then you'll get the number of 3 or 4 surface fillings.
Awesome.
And then you'll have that ratio, and 100 crowns to 80 3 to 4 surface fillings, so 5 to 4 is kind of your standard ratio. So in this case, it was, way out of whack.
Okay, for sure. Okay, cool.
So looking at that right away, you would know that the office was very conservative on their diagnosis of, what needed a direct restoration versus an indirect restoration, just statistically.
Overly conservative. Absolutely. Okay, cool. Let's move on.
And then the other one that I looked at was the number of x-rays they had taken. One thing Derek mentioned in the interview that he kind of mentioned to me as he was coming into this office was how overdue patients were for receiving radiographs. And so I looked back at their diagnostic codes to see kind of how many radiographs they were taking, and they took almost no full mouth series, almost no panos, and every time they did a bite wing, more than half the time it was 2 bite wings and not 4. So right there you kind of see that they're not really looking at anything, so they're not going to find things that are there. And so I think those are 2 really good areas to look at, the crown to filling ratio, and then also if you're looking through those procedure codes, looking at their specific x-ray ratios and how many full mouth series they take on their existing patients.
Cool. Well, that's awesome. Those are some really specific tools that people can use looking at analyzing practices and their numbers. So that was a great way to kind of recap and add some value to this awesome interview.
I kind of felt like I had to, because in my episode with you, I talk about internal growth reaching a certain point, and Derek just totally proved me wrong. And so I had to kind of figure out why. And I was really, scratching my head when he was going through his numbers with me, 4 months in, and I was like, man, I got to figure out what's going on. And so I think I got a clue as to what was happening in the practice before he walked in.
That's awesome. Well, cool. Well, if you guys enjoyed this interview, please share this on social media with your friends. Force someone to download it, steal their phone, put it on their phone, and then leave us a review when you get a chance. I think we're at 54 reviews in iTunes, so we really appreciate all those reviews that you guys have left, and we'll keep putting out the good episodes, and we'll see you next week.